I'd like to introduce Olivia Jefferson. She serves as the Vice President of Social Impact at Best Buy, where she is responsible for developing, executing, and enhancing Best Buy's social impact strategy to align company objectives and the external environment. In this role, Olivia also serves as the Executive Director for the Best Buy Foundation, leading, giving, and ensuring sound governance and fiscal responsibility for the Foundation's multi-million-dollar annual grants, programs, and employee engagement. Prior to Best Buy, Olivia was the Vice President of Philanthropic Programs at United Health Group, leading their largest philanthropic commitment, over $100 million, to diversify the healthcare workforce by providing 10,000 scholarships to underrepresented future and current health professionals. While at United Health Group, Olivia also led the strategic oversight and execution of the Empowering Health local partnerships and grant program focused on expanding access to care and addressing social determinants of health for people who are uninsured and underdeserved, along with United Healthcare Children's Foundation and employee volunteer programs. Olivia is driven by the possibility of creating a more equitable society. Everyone, welcome Olivia.
So I brought my cheat sheet to help with questions. And I am standing between you all at food and drinks. So let's go ahead and get this thing started. So I am at Best Buy now. You all heard a little bit about my background. It's mostly been in addressing the social determinants of health. And what I can say is core to me is always thinking about equity and also equity within access. What I have found to be incredibly refreshing about being at Best Buy is they are so core to their mission, which is why I love to start here. As someone who's been in philanthropy, particularly in health, we are often trying to be everything to everyone, and that is very difficult. But here at Best Buy, I feel like I'm able to just lock in and be really laser focused. And also, Nancy, I used to lead some of those questions that you got, so if anyone wants to know, I'm happy to help answer that. But really the core of what we do at Best Buy is all about enriching lives through technology. And so what I'm gonna talk to you about today is how we do that from a social impact lens, and then also a little bit about health and how we've converged those things together. So in my bio, what was mentioned is that I have social impact and I also have the Best Buy Foundation, and I like to try to explain this a little bit because it helps in terms of framing the work. So I always say I wear two hats. So one of them is the social impact side of the organization. And the way we're set up is we have a leadership team who really governs this side of the work. And what that means is that we are really trying to be integrated with the business and business initiatives, and you can see them listed here. Couple I want to call out are things that are really paid for by the company. And so things like charitable donations and sponsorships. If you see us oftentimes in community, we're showing up on behalf of Best Buy, not necessarily the Best Buy Foundation. We do a lot in response to disaster relief, particularly around natural disasters. So we've seen so much happening with folks in our probably extended families around the hurricanes. And so we've done a lot to support our current employees in stores and fulfillment, but then also the broader community. And then finally, we have what's called Geek Squad Academy. I call this out in particular because many of you who shop at Best Buy, you know when you get things serviced, it's by Geek Squad. And so what we do is we have camps that go on throughout the summer across the US who are led by our Geek Squad agents, and they basically work with young people to help them learn how to do coding using things like GarageBand, things that you would have access to on your iPhone, but a lot of these young people, because they come from disinvested communities, may not have that access, and so we provide them with those tools to hopefully start to engage them into hopefully a career in tech. On the other side of the hat that I wear is the Best Buy Foundation. And so what's under this is truly our signature program, which many of you may know, which is our Teen Tech Centers, and I'll get into that a little bit later. We also provide career pathways grants for nonprofit organizations in the Twin Cities and also in Seattle, which is like our second headquarters. And we do that because we're really thinking about how do we create economic opportunity and mobility for young people. And a big way to do that is to think about that from a career pathway in technology. So what's also really unique about us is because we're a retailer, we have to really pay attention to what our stakeholders want. And so the biggest headline here is that consumers care. They want to purchase from companies that are socially responsible. And so 86% of our consumer base says, yep, we shop at Best Buy because we know they have some type of social footprint and community. We also know that our employees care, and so 71% of them believe that they volunteer and care because Best Buy is so socially conscious and shows up in the community, particularly with young people and particularly around access. And then finally, our investors care. And so 9 out of 10 of them, of the investors in the broader community, believe that they want to also put their money into organizations that are socially responsible and are thinking about not just youth or what their core, what might be connected to their core mission, but also our environment as a whole. So to talk a little bit about the teen tech centers, here's a picture of actually one of our tech centers. And what you would find, the way I love to talk about these young people, although they are from historically disinvested communities and they may lack things like the devices, they may lack internet access, connectivity, and in some cases even guidance to, in a sense, navigate today's very technologically driven world, what they don't lack is brilliance. If you were to meet any of these young people, I guarantee most of you would want to hire them. And that's the thing that I hear when I take our board and other executives through many of these places. And I always say that these young people are tomorrow's future designers, engineers, artists, and entrepreneurs because they're doing it now. They're already trying to solve a lot of the problems that we see today. And so it's a really exciting space to be in. I also like to say that we're not just creating safe spaces for young people to tinker with tech. We're actually trying to move them from being consumers to leaders and owners of technology. And so as part of that, yes, we want to create safe spaces for young people to have access to tech, but once you hit a certain age, especially if you are from a community where you've been historically not invested in, it's not enough to just tinker. At some point, we may have to shift into what is next for you. And because of the many barriers that some of these young people have experienced in their K through 12 academic years, college may not be the next best step for them. But that doesn't mean that they shouldn't have a great career and be able to add to the economy. And so what we're trying to say is we're helping to credential them, we're helping to make sure that they have certifications and that hopefully they can come out and be competing in our global economy. We do want to just call out one of our long-standing partners, which is the Clubhouse Network. They are the organization that we use to implement in terms of the model in all of our teen tech centers, and it was developed out of MIT. And we are on a path to 100 locations. People often ask me, why 100? Couple reasons, but really transparently. After the killing of George Floyd, Best Buy made several bold commitments. One of them was to expand our footprint in terms of these tech centers because of the community that we're serving these young people. And we are about 60-ish in terms of meeting that 100 goal. And while a lot of other companies, no disrespect to them, have pulled back from those commitments, we are completely aligned and driving forward, and that makes me get up every day committed to this work because I know this is going to help a lot of young people. So it's just really exciting to see that we are continuing to move forward in a lot of the commitments that we've made. And then why most of you are here. You want to hear more about Best Buy Health. So a little caveat, I have been with the company for 4 months, which is why I have my little cheat sheet. So if you want to talk to me more about the health, we can get to that, but just know this is not necessarily the work that I lead every single day. But a big part of the work of Best Buy Health is a really big goal. And a part of that is they want to make sure that equity is at the center of all the work that we do when it comes to health, and that we are enabling care for people at home, and that is across the healthcare continuum. So the way that their strategy in Best Buy Health looks is that they think about their work from ongoing wellness all the way up to clinical trials, which means that we are working on behalf of consumers. We're also thinking about pharma and partnering with them and making sure that we are able to support someone along their healthcare continuum. So we talked a little bit about how, yes, the Fitbits and all those apps don't necessarily encourage you to be healthy. They might give you a little boost here and there, but they don't necessarily always change behavior. But as a tech company, we're gonna keep selling those things because we know that they are, at some level, a little helpful. But then also, as you continue to age, we have things like our partnership with Lively, where if someone falls or hurts themselves, that they immediately can reach out and call someone and get the type of health care and support that they need right away. Again, in terms of just across the continuum of care, one of the things that we're really proud of is our remote monitoring work that we've been in partnership with Epic. We have a lot of different connected devices to really help manage chronic care, thinking about how you can be healthy in home. So really trying to make sure that we're bringing even some of our Geek Squad agents to do certain things within the home around health. So really just trying to expand our footprint in this area because we know technology is changing faster than ever, and almost every career as we're moving forward is going to have an underpinning of health, and so, of technology, and so we need to be keeping up with the rest of the way the world is moving. As I talked about this in terms of their health equity focus, what I was really impressed with when I joined the company is that they started with what's called equity centered design, which is really about how are you designing your products? How do you have practices that are really around your end users and thinking about them first and their experiences and then designing your products? Talking with people and consumers from those demographics and making sure you're getting it right the first time. And that is something that, we all should sort of think about because one, is from a cost-saving perspective, but two, when you feel seen and heard and valued, you really feel like you are a part of the healthcare system and not that something's being done to you, but you help to inform it. I often think about stores like Target and different other stores. When you go in there, you want to know that there's products for you, things that you care about and you feel valued and seen. That's why we walk out with 50 things that we didn't anticipate walking out with, because we're roaming the aisles and we're like, wow, yes, this makes sense. I actually may need that. And I think that was really pivotal for this team to really think about how are we designing our products and services in a different way. The other point that I just wanted to make on this slide too is where we're also seeing a lot more partnerships for us is in the area of increasing digital literacy. This is a place that I think Best Buy has authentic permission to play, if you will, because of who we are in the tech landscape. And so we continue to see more in our care centers around the country where we are actually helping a lot of our patients and consumers with their digital literacy. And then finally, where I want to end today is talking about how these things have converged within Best Buy. So we currently have one teen tech center that we opened last year with Atrium Health, and it is all about making sure that we continue to expose youth to technology, but that they're actually also being exposed to healthcare. There is a virtual clinic co-located in this space. And so what we've seen is that we're not just serving these young people, we're serving their families and the broader community. And eventually what Atrium would like to do is maybe even actually put a physical health clinic within that space. And it's really exciting. They're actually, I think, gonna apply for our RFP that's opening up in Chicago to replicate this model in that area. And so I'm hoping next year, if I'm invited back, I'll be able to talk to you about some of the data and different things that we've seen from the work that we've done together in terms of health and social impact within these teen tech centers. So I think that's it. Happy to take questions.
Appreciate for the presentation. Great insights. Well, this was something we've been discussing with our guests here a while ago. Now, as scaling and as aging population and things are evolving, we tend to re-engineer healthcare basically on a high level, right? And then if we simplify the things into 3A law, like affordability, availability, and accessibility wise, put this 3As as a central question. What do you think, and this question may be valid for our different guests, so like, what do you think, which of this A is tending to be more of a challenge as time goes by and as we evolve through the processes, and how we are actually, if we are addressing it, how we are doing it? Thank you.
I think you led with affordability. I think that continues to be one of the issues that we continue to see. I think we often sometimes can take for granted our access to technology and the things that we are exposed to, but if we go to certain different areas of even our own cities and our own suburbs, there are pockets of people who don't have access to the technology. So as we continue to become more digital and different health plans are offering these things, we have to constantly be thinking about the affordability piece, because they may not even have access to the internet to be able to engage in the products that we're creating, which is why I think it's so important to start with that equity-centered design. Because if you can't get partnerships to support the things that may be outside of your business, it's really difficult to, I think, actually succeed in this space. So I would say even at Best Buy, having to negotiate with even our vendors around, okay, well, if you're gonna offer this particular product and with this particular population, here are some of the things you may need to consider from an affordability perspective. And that's not an easy conversation. Yeah, but happy to turn it over to my other panelists, because I know this is a hot topic for all of us. I don't think anyone's gonna argue with Okay, especially my friends over at UHC. We're like, oh my gosh, this is one of the biggest things, right? Yeah.
How do you choose what to prioritize? I mean, this is this is a huge space, and you, even with your, stated very narrow focus on sort of better lives through technology, how do you know where to start and what to prioritize?
Yeah, I would say, not to give too much away, but I would say Best Buy right now is actually going through a strategy process, and so am I, even in social impact. I think as the world continues to change, what we have to make sure is that we are expanding how we make money. I just think that's just like the core of the matter. And so you all will see, I think, very soon that Best Buy is leaning into other spaces that some of even our competitors have leaned into. And it just helps us continue to diversify our funding, which I think then helps you to start to prioritize, but you also expand to scale as well. I would say for the work that I'm doing in social impact, one of the things I walked into is that we've been doing this work for 10 years, but what's really hard is to think about the scale of it and then to what end. Like, why are we doing this work? And so I'm coming in and saying, well, really, the whole purpose of this is to actually create economic opportunity and mobility for young people, right? That's the core of why we're doing this. And so now I'm helping the team think about, well, what's not in service to this new goal, and should we continue doing it? And that is a very hard conversation. Anyone who's ever had to lead a strategy process knows everyone is dying and is so stressed, but they never want to give up anything. And so you're like, okay, we got to put this over here because it's no longer in service to this. And it's just really tough. So I don't know, I feel like we're doing the best we can, but there's no magic bullet here. Yeah.
Thank you so much for your presentation. It's so wonderful to hear about Best Buy's focus on equity in particular. So thank you for your work in that way. What are you doing to measure the digital divide initiative that you're up to? And sort of just in terms of outcomes and equity, what kind of measurements are being taken and reported on?
So I can't necessarily, I don't know exactly what they're focused on in health, so apologies for that. But I'll say for us in social impact, one of the things that the first way I'm doing this is because we've been around for 10 years, we have some data, but if I'm honest with you, all of the tech centers look different. So if you go to a tech center in North Minneapolis, maybe what they want to focus on is music, right, and producing music. And then if you were to go to one of our tech centers in Seattle, what they're focused on is robotics. But what I'm trying to now do is figure out where do we standardize some of the career pathways. So if we want young people to have a credential or a certification, what is it that we're offering that's standard across many of these teen tech centers? And that's where we're going. So then I can come back to not just you all, but my board and say, here's the number or the percentage of our young people who are credentialed and have gone into X company or are going into this field, whether it be tech or health or what I like to call tech-aligned organizations, because I think that data is gonna be the most important thing. Yeah, I agree.
Well,
I'm sure people are ready to have their drinks.
One last question.
Oh, yeah, okay.
I like to put this very important perspective about this prioritizing of this affordability, accessibility aspect. And we are very privileged to be sitting in Minnesota. This is one of the areas which have very high resources, both financial as well as human resources. But if we see across the world, we don't have much of neither manpower, neither have much of the financial resources for them to get access it. So if you think from that side, which I've been leading a couple of organizations and in terms of providing healthcare, the way we have been prioritizing is that we know that we have so many limitations, manpower, financial, but always drive and missions to how many human lives you are impacting and how we are going to increase that impact from today to tomorrow. And that need to be inculcated from top to bottom, even the smallest level of employee. And that's how we keep thinking and leading. Plus, we know that definitely financial side is there, which we have to think about and how the organization is going to grow and what the profitability and other things. But always we have made the mission that how we are going to improve the total number of impact what we had today from today to tomorrow. Thank you.
That's not a question, that was a statement.
Thank you. well, thank you so much, Olivia.